Have you ever wondered what happens when doctors put you to sleep for surgery? It's like having a magic power that can turn off your consciousness completely, then bring you back safely. Today we're going to explore the fascinating science of anesthesia and discover how doctors can make you unconscious in a controlled, safe way. This isn't about natural sleep, it's about something much more incredible that helps millions of people every day. Anesthesia is a special medicine that doctors use to make you unconscious during surgery so you don't feel any pain. Think of it like a temporary off switch for your awareness and pain sensors. The word anesthesia actually means without sensation in Greek, which perfectly describes what it does. Unlike regular sleep where you can still hear sounds or be woken up easily, anesthesia creates a much deeper state where nothing can disturb you. It's one of the most important discoveries in medical history because it allows doctors to perform complex surgeries while keeping patients completely comfortable. Your brain works like a busy city with billions of nerve cells called neurons sending electrical messages to each other constantly. These neurons create networks that control everything from your heartbeat to your thoughts and memories. When you're awake, these neural networks are buzzing with activity, communicating back and forth to keep you conscious and aware. Scientists believe consciousness comes from these networks working together in perfect harmony. Understanding how your brain creates awareness helps us understand how anesthesia can temporarily interrupt it. Anesthetic drugs work by interrupting the normal communication between your brain's neural networks. They attach to special receptors on your neurons and either block signals from getting through or slow them down dramatically. It's like putting speed bumps on all the highways in that busy brain city we talked about. When these communication pathways get disrupted, the networks can't work together anymore, and your consciousness gradually fades away. Scientists are still learning exactly how this process works, but they know it's much more complex than simply turning off your brain. There are actually three main types of anesthesia that doctors can choose from depending on what kind of procedure you need. General anesthesia makes you completely unconscious and is used for major surgeries like removing an appendix. Local anesthesia only numbs a small area, like when a dentist freezes your mouth to fill a cavity. Conscious sedation makes you very relaxed and sleepy, but you're still somewhat awake, often used for minor procedures. Each type uses different medicines and techniques, but they all work by affecting how your neurons communicate with each other. During surgery, a special doctor called an anesthesiologist watches over you the entire time to make sure you're safe. They use amazing machines that monitor your heart rate, breathing, blood pressure, and even the electrical activity in your brain. These monitors beep and show colorful waves on screens, giving the medical team instant information about how your body is doing. The anesthesiologist can adjust the amount of medicine you're getting throughout the surgery to keep you at exactly the right level of unconsciousness. They're like expert pilots flying you safely through the journey of surgery and back to wakefulness. When surgery is finished, the anesthesia medicine gradually leaves your body and your neural networks slowly start communicating normally again. It's like the speed bumps are being removed from those brain highways and traffic can flow smoothly once more. You'll usually wake up feeling groggy and confused at first, which is completely normal as your brain networks reconnect. Most people don't remember anything from the time they went to sleep until they wake up, creating a gap in their memory. This controlled return to consciousness is just as carefully managed as the process of going under anesthesia. Anesthesia has revolutionized medicine by allowing doctors to perform surgeries that would be impossible if patients were awake and feeling pain. Before anesthesia was invented, surgery was incredibly traumatic and many people died from shock and pain rather than their actual medical condition. Today, millions of people have life-saving operations every year thanks to these amazing medicines that can safely turn off consciousness. From heart transplants to brain surgery, anesthesia makes it possible for doctors to take the time they need to help people heal. It's truly one of the greatest gifts that medical science has given to humanity. What's the most interesting thing you learned about anesthesia today? I'd love to hear your thoughts in the comments section below. And if you enjoyed learning about this amazing medical science, please consider subscribing to the channel for more fascinating topics that explain how our world works.